So Dr. Russo, can you let our listeners know really the difference between bioidentical hormone replacement therapy and regular hormone replacement therapy?
Of course, that's a really important question. Thank you for asking. So, bioidentical hormones implies that the hormones are structurally and chemically identical to the hormones that your body makes. And so they're not synthetic, they are natural. They are natural to human females or human males. And that's what makes them different about compared to synthetic, which are not similar structurally or chemically.
Awesome. Yeah, very important because you know that I don't know, and maybe you can answer this question too. I know 20 years ago, many bioidentical hormones were just kind of coming on the scene, but many of our regular gynecologists are not prescribing bioidentical hormones. Is that the case, or is it? Do you have a choice as a consumer when you're talking to your provider?
So, what we learned about the differences of synthetic versus bioidentical hormones goes back to a very large study that was done in the late 1990s and early 2000s. It was called the Women's Health Initiative Study. And there were three groups of women in that study, and it went on for several years. There were a group of women who received Premarin, which is a synthetic estrogen. It's made from horse urine. Many people have heard of that. There was a group of women that received a placebo. And then there was a group of women that received Prem-Pro, which was a menopause drug available at the time. It actually is still available, but it contains Premarin and a synthetic progestin. And what the studies found was that the women in the Prem-Pro group had a higher rate of breast cancer. And so the headlines came out that HRT causes breast cancer. But what we learned in the follow-up studies was that it was the synthetic progestin, the Provera component of the Prem-Pro, that actually increases the woman's risk of breast cancer. And it is bioidentical progesterone, which is what we use at Carolina HealthSpan, does not increase your risk of breast cancer, and in some cases can be breast cancer protective. And the group of women who received Premarin, the synthetic estrogen, actually had a lower rate of breast cancer, although not statistically statistically significant compared to the placebo group. So it was the progestin component. And so knowing the difference of whether you're getting a bioidentical versus a synthetic hormone can be very important.
Yes, absolutely. All right. Well, I want your listeners to stay tuned because next week we're going to talk about testosterone and
Yes,
really
we are.
testosterone and the role that plays with women. So there's a lot of misconception out there about it, and it's such an important hormone for women. So we will definitely talk about that soon. Thank you again, Dr. Russo.
Thank you. Nice to talk with you.